Assalamualaikum warahmatullahi wabarakatuh. My name is Nonali Farzana binti Ahmad Faizal. I'm a BCT student and I'll be presenting about abnormal rhythms in ECG. So, here is the topics that we learned abnormal rhythms. Firstly is normal conduction system. Secondly is myocardial infarction, and lastly is treatment myocardial infarction. In normal conduction system, we'll be learning about definition, components, steps in conduction process, and what happens if conduction system is abnormal. So there are a few of abnormalities in conduction systems, but today we'll be focusing about myocardial infarction. In myocardial infarction, we'll be learning about definition, causes, symptoms, and diagnosis. And lastly is a treatment myocardial infarction, which we'll be learning about types of treatment and management for myocardial infarction patient. So, what is conduction system? Conduction system, it is a specialized network of cells that generates the heart's contractions to effectively pump blood throughout the body. This signal causes different parts of heart to expand and contract. The expansion and contraction control blood flow through your heart and body. So, what is the components of conduction system? As you can see here, it is the structure of the heart. We have aorta, pulmonary arteries, atrium, ventricle, Purkinje fibers, left bundle branch, right bundle branch, bundle of His, atrioventricle, AV node, and sinoatrial SE node. So the differences between this red color and yellow color is that the yellow color is where I highlighted the components that are involved in conduction system process. So, sinoatrial node, SE node, it is known as heart's natural pacemaker, which located at right atrium. It is functioned to generate electrical impulses at the rate of 60 to 100 beats per minute under normal conditions. This also initiates each heartbeat. And then we have atrioventricular AV node, which positioned at junction between atria and ventricles. It is receive impulses from SE node and introduce a brief delay. So it allows atria to fully contract and fill ventricles with blood before ventricular contraction begins. Furthermore, we have bundle of His. Bundle of His, also known as atrioventricular bundle. It conducts impulses from every node into ventricles, which splits into right and left bundle branches that travel down the interventricular septum. And lastly is a Purkinje fibers. These fibers extend from bundle branches into ventricular walls, which facilitate rapid transmission of electrical impulses throughout the ventricles. These Purkinje fibers also can lead to coordinated contraction. So here is the steps in the conduction system, which also can be represented in electrocardiogram. So in this diagram is a ECG, is a normal ECG. So firstly we have P wave. P wave represents as atrial depolarization, where SE node firing electrical impulses. This indicates atrial contraction and first deflection on ECG. Then we have PR interval, also known as PR segment. This PR interval, which represents as signal delay, it is where time taken for electrical impulses travel from SE node through AV node to ventricles. Thirdly, we have QRS complex, which represents as ventricular depolarization. This ventricular depolarization where impulse reach through bundle of His and Purkinje fibers. This can cause ventricular contraction. The purple color is ST segment. ST segment represents as ventricles fully depolarized before repolarization begins. Then lastly is T wave. T wave represents as ventricle repolarization, where also known as ventricular contraction. This is a recovery phase of ventricles as they return to their resting state. So what happens if conduction system is abnormal? It will lead to a lot of kind of disease, but I will present about and focus on myocardial infarction. Myocardial infarction, also commonly known as a heart attack, occurs when blood flow to a part of the heart is suddenly blocked, which leading to tissue damage. This interruption in blood supply is primarily caused by coronary artery disease, where arteries become narrowed due to blood buildup, a process known as atherosclerosis. What are the causes of myocardial infarction? There are three types of causes in myocardial infarction. Firstly is coronary artery disease, coronary artery spasm, and other factors. In coronary artery disease, it is where accumulation of fatty deposits, also known as plaques, in the coronary arteries. These rupture and form blood clots that obstruct blood flow to the heart muscle. Then we have coronary artery spasm, which are less frequent, and then it is sudden contraction of coronary arteries can temporarily reduce or stop blood flow. This coronary artery spasm causes by drug use, which such as cocaine. And the other factors is that due to increase or oxygen demand or decreased blood supply because of severe anemia or hypotension. This disease also can lead to MI. So what are the risk factors of myocardial infarction? There are two types of risk factors myocardial infarction. Firstly is modifiable and non-modifiable. For modifiable, it is due to the environmental factors. For example, is high blood pressure, high cholesterol levels, smoking, and obesity. But for non-modifiable, it is due to age, gender, and family history of heart disease. Next is the symptoms. There are a lot of symptoms of myocardial infarction. Firstly is chest pain, shortness of breath, sweating, fainting or lightheadedness, and nausea or vomiting. Then we'll be going to diagnosis test for patient that diagnosed with myocardial infarction. So one of it is electrocardiogram. So here are example one of ECG myocardial infarction patient. As you can see here, this is a diagram of ECG, 12-lead ECG. So in the purple color is the ST segment elevation, which concave downward in anterior leads V3 and V4 at G point. Then the highlighted yellow color is reciprocal ST segment depression in inferior leads 2, 3, and LVF. In this ECG also, we have poor R wave progression. Then example 2 of ECG myocardial infarction. As you can see here, in the highlighted green color is ST segment elevation in right chest V3R to VCR, which are indicative right ventricular injury. Then the blue highlighted color is where acute inferior stimuli in leads 2, 3, and LVF. This patient diagnosis with right ventricular MI, which only seen with proximal right coronary occlusion with inferior family MI. Then example 3 of ECG myocardial infarction. As you can see here, in the red color is tall R waves. The blue highlighted color is tall R waves in V1 to V3. Meanwhile, the red colors is deep Q waves in leads 2, 3, and LVF. In this ECG also, we can see residual STT wave abnormalities are also evident. So this patient diagnosed with true all inferior posterior MI. Then treatment management for patient that diagnosed with myocardial infarction. In treatment, we have percutaneous coronary intervention PCI, which also known as a procedure that opens blocked arteries using a balloon and often places a stent to keep the artery opened. Then coronary artery bypass grafting CABG is a surgical procedure that creates a new path for blood to flow around blocked arteries. In management, the patient will be preserved medication, which also long-term medication. For example, is antiplatelet agent such as aspirin and clotbusters, thrombolytics, and anticoagulants. Also, patient needs to change their lifestyle modification, which emphasize on dietary changes, smoking cessation, and regular physical activity to reduce risk of recurrent MI. In conclusion, MI is a critical condition which resulting from reduced blood supply to the heart muscle, primarily due to coronary artery disease. Understanding its causes, risk factors, symptoms, and treatment options is essential for effective prevention and management. Prompt medical attention is crucial for improving outcomes following an MI. So that's all from me. Thank you. Bye.